give some awareness, this coming 25th of the month, ang ating health sector ay nagsiselebrate ng World Malaria Day to raise awareness specifically about the prevention and control of the malarial disease. Dito po ay na-advocate po ang tamang diagnosis at treatment for the infected individuals. Ano nga ba ang malaria, mga kasangbahay? Ang malaria ay mula sa parasite galing sa lamok na tinatawag na Anopheles mosquitoes. Nakakamatay itong sakit at karaniwang laganap sa mga tropical countries gaya po ng ating bansa. Katunayan, noong 2022 na itala ng World Health Organization na umabot sa 249 million ang kaso ng malaria at nasa mahigit 600,000 naman ang mga namatay sa iba't ibang bansa sa buong mundo. Kaya naman, huwag po natin baliwalain mga kasangbahayang malaria. Panatilihin nating malinis ang ating paligid upang maiwasan ang pagbabahay ng lamok na maaaring magdulot ng sakit na ito. And moving forward, mga kasangbahay, dakaw na po tayo sa pag-uusapan natin ngayong araw. Ito ay ang tungkol sa Carpal Tunnel Syndrome. At para po maipaliwanag ito at maintindihan natin kung ano nga ba ito, I am thrilled to introduce our esteemed guest today, whose exceptional expertise has made an indelible impact on hand and wrist health. Her unparalleled knowledge in this field has transformed the lives of many, and we are honored to have her here with us today. Let us welcome Dr. Tiffany Kanapi, Coromina, an orthopedic surgeon from Makati Medical Center. Good morning, Dr. Tiff. I just call you Doc Tiff, right?
Yes. Good morning, Doctor. It's
Hi.
lovely to meet you.
Yeah, same here. And welcome to Doctors on TV.
Thank you for having me.
Yeah, and you might want to greet our viewers muna, Doc.
Good morning, mga kasangbahay. Nice to have you. Thank you for listening.
Yeah, okay. You're very sweet, Doktora.
Kasi nag-coffee na ako.
Okay, so ang pag-uusapan natin is Carpal Tunnel Syndrome. So, okay, so to begin with, ano nga po ba itong condition na to?
Carpal Tunnel Syndrome, there are 3 nerves na nagbibigay ng buhay sa upper extremity. The radial, the median, and the ulnar. Carpal tunnel, naiipit yung median nerve.
Yung nasa gitna, Doc?
Yeah, well, nagbabago ng pwesto yan eh. Pero naiipit siya at the level of the wrist. Dito yung carpal tunnel. And then pag naiipit siya doon, then it's called the carpal tunnel syndrome.
I see. Okay. And is this very common?
It's the most common compression in the upper extremity, especially among the 3 nerves. And kasi pwedeng naiipit yan anywhere from the neck down eh. So dito siya madalas naiipit.
I see. And paano usually nagde-develop to? Paano nagkakaroon ng ang isang individual ng carpal tunnel syndrome?
Some people, minsan napapansin mo, it runs in families. Yes, but that's more on the bihira yun eh. Pero nangyayari yun, madalas, it's the position of the wrist. May I borrow your hand?
Sure.
Alright. So, the carpal tunnel is here. Ang ganda ng nails ni Doktora. I wish I also had my nails done. So, the carpal tunnel is here. When it is most patent or open, pag neutral. Now, when you extend the wrist, minsan typing,
Yeah.
riding the motorbike, pag nagmumotor, or when it's flexed, when you're sleeping, di ba minsan masarap matulog ng ganyan?
Yeah.
Then, nag-increase yung pressure and then nasasakal yung nerve. So, it's this prolonged abnormal positioning of the wrist that sometimes increases or makes you more prone. Pero kasi, not everyone, thank you,
Yeah.
not everyone gets it kasi everyone uses the computer, everyone goes to sleep. Minsan may kaakap kang unan, ganyan.
Yeah.
But sometimes it does aggravate for certain people. So that's how the pressure on the nerve happens and then namamaga, there's synovitis, and then minsan paulit-ulit yung ipit and then there comes a time na paulit-ulit hindi na nakaka-recover yung nerve and then it becomes more severe carpal tunnel syndrome.
I see. Okay, kanina na-mention nyo, so na-mention ko yung mga nagmo-motorbike, okay, yung mga nagtatype. So does it mean talagang may occupational risk din dito? Pag may certain group of people na sila yung mas prone to have carpal tunnel, is that
Actually,
so?
no. It's across the board. It's just some people, the repetitive wrong positions makes them more prone. But then, yun nga, like I said, we're in the age of computers. Lahat tayo nagka-computer, lahat tayo nagka-cellphone. Pero hindi naman lahat nagka-carpal tunnel. Pero that explains yung kung ano yung nangyayari, kung bakit naiipit yung nerve.
And meron ba siyang gene predilection? Ibig sabihin na namamana, like kanina may na-mention kayo kung may kasama sa family?
On some rare occasions, bihira lang. I have yet to see any studies, but we can look into that. Pero mostly, there are some factors na nag-aggravate. Hindi siya directly yung cause, pero naka-aggravate siya. These factors include pregnancy, obesity. Do I point at myself also?
You're on
that's
the
that
way.
point. That's that point. hypothyroidism.
Why hypothyroidism?
They cannot yet establish a cause, but it's more of if you have these, like diabetes, these factors, there's a higher likelihood of seeing carpal tunnel. Hindi siya causality, but nagsasabay minsan.
Oh, and nakita siguro nila sa studies na parang
Nagsasabay, yes,
because hypothyroid individuals happen to be happen
They have
to
higher-
experience carpal tunnel.
Mas mataas po yung incidence
I see.
or prevalence among patients with these risk factors.
How about sa gender, doc? Mas common ba yun sa babae or sa lalaki?
Usually among females, but again, some males also have them, but slightly higher among the female population.
Females. Okay. And kanya na-mention nyo, di ba, may mga, merong mga certain habits, okay, na usually common among adults. Does it mean parang this is less common among kids?
Not so much in children, no, but I've honestly yet to see studies, but I often see them among adults. So it's not so common in children.
Mm-hmm. Okay. And ito, doc, no, how would one at least have an idea na baka carpal tunnel syndrome yung meron ako?
Mhm.
Ano yung usual manifestation sa mga patients having this condition?
If it's early, borrow again your
Okay.
pretty hands.
Pangalawa na yun, doktor.
Yes, the third one, ningil ka na.
Yeah.
You have numbness and tingling of these 3 half fingers. Pero minsan, thank you, in some patients, pakiramdam nila makapal, buong kamay. Minsan kasi hindi na-distinguish ng brain kung aling mga daliri ba, or sometimes hindi aware yung pasyente. But it's usually numbness and tingling of the fingers pag maaga, minsan parang langgam, tusok-tusok. Sometimes people wake up, makapal yung pakiramdam, they don't know why, pero makapal yung pakiramdam ng kamay. Pero in the more severe cases, yung mga taon na inaalagaan, nakabagsak na yan ng gamit. And then, pangatlo, maningil na tayo.
Sige.
If you look at the hand, medyo may laman. Yung iba, flat na yan. That's a sign of chronicity. Yung years ng inaalagaan, it's very flat already.
I see.
Also pala, if it's early, nagigising ka sa gabi, you have to do this. Parang masakit yung kamay. That's another symptom of carpal tunnel if it's early. You also have sometimes kumukuryente here, or sometimes the whole arm aches.
Oh, okay.
So those are the general symptoms. Syempre,
So is that like focus on the wrist na alone or on the hand alone? Pwede siyang mag-radiate?
sometimes, but it can also be other things. But that's why it's the best thing to do is pagpatingin. Kasi
I
nga,
see,
tayo, we're used to figuring out alin ba ang alin.
Yeah. And usually sa mga may carpal tunnel syndrome, ano yung mga activity limitations?
No limitations. Unless you have symptoms, and then ako, I tailor. I see, saan ba? Because I'm a believer na yung gamit ng kamay mo is different from the way another person uses your hand. Their hands. So I see what aggravates ba in this certain person. Like an example, but this is just example, I had a patient, baker. Kasi naka-extend and nagpe-pressure. I had another patient pag sumasakay ng angkas. Kasi when they hold like this. So there's extreme positioning. But these are some rare occasions that I just remember, but it's not standard. So I tailor it to the patient kung what bang paggamit ng, nasan ba sa paggamit ng kamay mo na nag-aggravate ng symptoms, then we can adjust.
So the manifestations are actually case-to-case. On a case-to-case basis. So magkakaiba, it varies from one individual to another.
For me, yes. For me,
okay.
yes.
And how long para mag-manifest? Okay, say for example, meron bang like incidental finding lang muna over imaging studies, or talagang usually it's symptomatic based na dadating sa clinic niyo yung patient, or usually sa ER ba yan?
Carpal tunnel syndrome primarily diagnosed clinical basis. The doctor talks to the patient, examines the patient, and then there are other diagnostic tests like a nerve test, but we usually use that kapag kailangan lang ng suportahan yung what we already suspect. Pero primarily, diagnose siya in a clinical setting. We examine the patient, we talk to them, there are certain tests that we do, and then that's how you form the diagnosis of carpal tunnel syndrome.
I see. And di ba sabi kasi when it's a syndrome, ibig sabihin it's a combination of different disorders. But in carpal tunnel syndrome, what's the case?
You get the syndrome where you have the numbness, the waking up at night,
all
the constellation of symptoms, yun yung syndrome.
Kaya siya syndrome.
Yes.
Okay. And ano usually yung mga complications, Doc, kapag nagkaroon ng carpal tunnel syndrome and hindi na ma-manage?
Pag tumatagal, ibang mga pasyente dumarating, Doc, 10 taon na, And then, hindi na nawawala yung manhid. In the beginning, sabi ko, di ba, parang cycle yan. Naiipit, tas nakapahinga, naiipit, tas nakapahinga. Pero minsan, over the years, tuloy-tuloy naiipit, hindi na nakaka-recover yung nerve. So, pag ganun, permanent na yung manhid. Or minsan, like I said, yung laman dito, flat na, minsan hindi na nababalik yon. Pati yung lakas ng hand. And that's the more end or severe kapag talagang hindi nagpapatingin yung pasyente or ilang taon hindi na napapansin.
So, is this lifelong?
If you address it early, and then you can adjust, nawawala yung symptoms, then it's not a lifelong issue. It's not like hypertension or diabetes na forever necessary yan. Yung ipit ng nerve can be alleviated.
Okay, so, but what has caused the carpal tunnel syndrome is, say, for example, it's occupational driven. Meron kang trabaho, ito yung lagi mong posture, and that actually has brought about the carpal tunnel syndrome. So, is there still a way na parang maiwasan mo pa siya? I mean, considering na kunyari na manage mo siya, kaya lang, but of course, that same pwesto, di ba, ng kamay na lagi naka-flex, okay, so, yun yung talagang reason. So, paano? Kailangan ba magpalit ng job?
Yun
Isang
naman.
individual?
It's not occupation driven because again, a lot of people drive motorcycles, bikes, a lot of people use computers, and not everyone naman nagkakaroon ng carpal tunnel. So it's again case-to-case basis. Sometimes adjustments need to be made, and then you see how the patient responds.
I see. Okay, napakaganda ng introduction natin sa carpal tunnel syndrome. But later, Doc, we'll be discussing naman about the diagnostic measures, no? Tsaka yung management, of course, ng carpal tunnel syndrome. Okay, we will pause for a break at papatuloy po natin mamaya lamang ang ating usapan. Ako kaya mga kasambahay, dyan lamang kayo at magbabalik pa rin ng Doctors on TV. Welcome back mga kasambahay! Before we continue our discussion, we'd like to invite you to follow and subscribe to our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv. And like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. Kung maaari niyo pong balik-balikan mga kasambay ang mga episodes ng Doctors on TV, yan po ay sa aming Facebook page at YouTube channel. Kaya after liking and subscribing, i-share niyo na din po sa inyong mga friends and family. Dahil napakahalaga po ng pagkakaroon ng awareness, lalo na tungkol sa ating kalusugan. At para pa rin po sa pagpapatuloy ng ating talakayan, still here with us is Dr. Tiffany Kanapi, Coromina, an Orthopedic Surgeon from Makati Medical Center. Okay, this time around, Doktora, we'll be discussing about the diagnostic procedures that you usually request to come up with a diagnosis of carpal tunnel syndrome, and syempre later on, yung management. Okay, so ito here, pag dumating sa inyo yung pasyente, say for example sa clinic, in your practice, medyo pagpasok pa lang, medyo may idea ka na ba na carpal tunnel to? Kita na ba?
I wish I were that good. No, it really comes kapag nakakausap yung pasyente, na-examine yung patient. It is primarily diagnosed clinically. May mga additional tests, pero yun lang kasi kapag yung nerve test, nagdududa kami kung dito lang ba yung ipit kasi minsan naiipit pa yan sa leeg. Or pag hindi masyadong clear yung pasyente as to how long na nila nararamdaman, may ibang mga pasyente kasi napakatiisin, hindi napapansin how long. So there are tests, pero supportive lang yon. Only to help us confirm yung diagnosis, primarily sa clinic.
Okay, so how about, Doktor, mga imaging studies? I mean, you mentioned about na clinically pwede nang ma-diagnose si carpal tunnel. But do you request for some imaging studies?
May mga bagong studies that say an MRI, makikita mo kung naipit yung nerve. An MRI can also show you, kasi bihira, pero nagkakataon, minsan may mga pasyente may mga bukol sa loob, kaya naiipit yung nerve, but hindi po siya routine.
Ay, so kaya saka medyo mahal pa rin ng MRI, no?
Routine.
So kung kaya mo naman na without further expenditure, wala nang gastos yung pasyente, di ba? Mas okay. Okay, so apart from that, okay, so and then after that, diretso na kayo sa management nun.
Yes.
And what do you usually do? Ano yung step 1, 2, for the treatment?
Number 1, alamin anong nagpapa-aggravate sa sintomas ng pasyente. Anong mga gawa nagpapa-labas or nagpapa-aggravate ng symptoms. Minsan yung ibang pasyente sa gabi, So, pag ganon, pagising nila, makapal yung kamay, o kaya manhid, then we splint at night habang tulog.
Oh.
Para yung wrist, they stay neutral, hindi siya naka-extend or hindi siya naka-bend ng ganyan.
Isn't that too uncomfortable? Kasi di ba parang yung pagtulog mo, yun lang yung parang okay, relax na relax ka. And then, eto, biglang you come with a splint dito sa area na affected.
They adjust. Kasi ang kapalit naman is, madadaganan mo yung nerve.
Yeah.
May ipit siya. And then, paulit-ulit yung ipit, pakunti-kunti namamatay siya.
Okay, and okay, so once na-identify na what really brings about the attack of pain, so what comes next?
You can also give minsan painkillers, anti-inflammatory, medications for a short period, and then sometimes physical therapy can help. And minsan, some doctors also give steroid injection. Sometimes.
Kami, doktor, if I may share, we have also some patients na merong carpal tunnel syndrome, especially my husband. Acupuncture really, does help.
Some doctors do. I personally don't because I wouldn't know anything about acupuncture. But some physical therapists offer.
Oh, yeah.
Hindi po siya standard, pero pwede siyang, hindi naman po siya nakakasama. So pag hindi naman nakakasama, I allow naman patients to try adjunctive or parang add-on.
I see. And after all these modifications, when does a patient with carpal tunnel syndrome first, feel relieved of this pain?
It's hard to say.
So iba-iba.
Iba-iba talaga. I've seen a whole variety. Sometimes they take longer, minsan takes a while. Without this, yung nauwi sa opera, yun yung mga 2 years na chronic na hindi nawawala yung manhid.
Okay, you mentioned about surgical intervention. Okay, so I mean, like paano kunyari, parang mas okay pa rin ma-surgery dahil pag nag-surgery na, tapos na problema?
Kapag tumatagal yung sintomas, or hindi na nawawala yung manhid, or nakita mo, mahina na yung mga nerves na binubuhay ng median nerve, then minsan, surgery is the better option. Kasi yung surgery, pinapakawalan yung ligament na umiipit sa nerve, nakakahinga na siya.
Okay, but can it come to the usual, the normal status pa rin kapag after surgery?
Kung masyadong malala, dun kami nahirapan. Kung 2 taon na siyang manhid, yung mga daliri mo, or kung 5 taon nang flat na flat yan, minsan hindi na namin ma-predict kung maibabalik pa namin yung part ng nerve na napatay. Oo, yun yung wala pang studies makasabi with certainty kailan mababalik. Pero kailangan pa rin kasi pag iniwan mo naman, isipin naman siya, hindi naman magbabago with surgery, bakit ko pa papagawa? Pero kasi tuloy-tuloy yung pagdagan sa nerve. So surgery can still be beneficial para hindi tuloy-tuloy yung damage to the nerve, even if matagal na.
Okay, so having mentioned that, so dito siguro papasok yung parang kailangan talaga nilang i-outweigh yung pros and cons. Kasi, like I remember, what if kunyari ang profession ng isang pasyente makeup artist, tapos ang affected hand would be yung dominant hand also na yun din yung ginagamit niya pang-perform. Okay, o kaya for example, yung iba yung mga artists.
Even surgeons.
Surgeons
Also get. Ang recovery period lang for surgery post-op, 6 weeks. 6 weeks na walang buhat na mabigat. 2 linggo average yung before tanggalin yung tahi, and then after that wala nang bawal. After surgery wala nang bawal.
Bakit natatakot din yung ibang patients to undergo surgery kahit na yun talaga yung highly recommended ng mga orthopedic surgeon nila?
Any surgery has risks. May risk yan ng infection, risk yan ng recurrence, risk ng injury when you go in. And syempre, any person, even ako, matatakot din ako for surgery. Pero, if beneficial siya, you have to take on the risks. Para, may kamay kang magagamit mo for now until forever.
Yeah, okay. Ang hirap kasi, di ba, parang our hands really help us a lot with a lot of tasks, no? Imagine, parang paralisado ka, does it happen na bilateral? Parehong kamay involved or it seldom happens?
It happens. Both hands, several patients, both hands. Pag ganon, we decide which hand is worse or which hand yung talagang bothersome or depende sa patient kung ano yung gusto nilang unahin. And then, we do the surgery.
I see. But what if, kunyari, the patient has finally decided, okay, so, sige, I will undergo the surgery. And then, sabi niyo nga kanina, the recuperation period would be like around 6 weeks, okay? And after that, parang the patient would be perfectly fine already.
After surgery, you can do light activities.
Light
you can
activities
write.
initially.
Yes, I have a few patients, nag-opera na Friday, by Monday, nagta-type na sila. It depends on the comfort of the patient. But you can do light activities, get dressed, eat, take a bath, susuputan mo lang para hindi mabasa yung sugat. Ang bawal lang for the first 6 weeks yung mabigat na buhat.
Oh.
But you can do everything. And siguro, right, motorcycle talaga mabibigat, nothing yet. But right after surgery, you can move your hand, you can put makeup, you can type, you can write.
Do you require physical therapy after surgery?
Not all patients, no. Hindi siya standard. Pero yung ibang pasyente, syempre, you give the type of management that is necessary for the patient if minsan hirap silang ikilos after.
Or probably it depends on the extent of severity prior to surgery.
Not necessary. It's more of how they recover.
I see. Talking about the success of the surgery, no? Meron bang mga cases, ano yung mga may group of individuals ba na sila yung medyo parang hindi mas restorative 100%?
Yung mga matagal na naaalagaan yung symptoms. Kasi nga, I would always tell my patients, hindi po kami si Jesus Christ. Pag patay na, patay na. Sometimes we cannot resurrect something na patay na. So, kung matagal ng yung part ng nerve na daganan, and then that part of the nerve napapatay na, minsan hindi na nababalik. Pero you prevent, with surgery, further damage to the other parts of the nerve na buhay pa. So, yun yung nagsustruggle na mabalik to before, which is probably decades or years, na fully functional.
I see. And is that the reason why sabi niyo may nagfa-flatten out na here? Because hindi na nagagamit yung muscle.
Hindi na yung part ng
innervated ng nerve
na bumubuhay dyan is naiipit na namamatay. In layman's terms, namamatay.
Naku, sayang. Sana pala maiwasan na lang, no?
Yes.
Yeah. And so, is it preventable?
Not necessarily preventable, pero ang pinakamaganda is if may kakaibang nararamdaman, magpatingin agad.
Yeah.
Para yung
Hindi
the
na
doctor
mag-worsen.
can assess specific to the patient. Yes.
I
Tama-tama, hindi na mag-worsen para hindi mapaglipasan ng oras na isasang tabi, hindi nagiging priority.
I see. Naku, Doktora. So, with all the information that you shared, so siguro this time around, can you give like some health advice to our viewers?
Kung may kakaibang nararamdaman sa kamay, tusok-tusok, manhid, sakit, basta may kakaiba, magpatingin agad para mahuli kung may problem, maagapan, and ma-prevent yung any further problems.
I see. And you might want to invite the viewers to visit you here at Makati Medical Center, and baka may gusto kayong batiin, Doktor.
Yes, I have clinic here almost every day in Makati Med. We also have a full roster of very capable, competent orthopedic surgeons and actually all the other doctors in the hospital. So please do come if there are any problems, and we're here for you.
Okay, thank you once again, Dr. Tiffany Kanapi Coromina, an orthopedic surgeon from Makati Medical Center. We hope mga kasambahay, marami po kayong natutunan sa ating episode. Consider this as your roadmap to adopting a healthy lifestyle. And it all starts with putting yourself first. Your health is priceless regardless how busy you may be. And with that, may pag-uusapan pa po tayo mamaya. Huwag po kayong bibitiw. Magbabalik ang Doctors on TV. Nagbabalik po ang Doctors on TV at para po sa dagdag kaalaman, paano kung ang ating mga anak ay nakakaramdam ng pain sa kanilang arm at wrist? Ano nga po ba ang dapat gawin? Panoorin po natin ito.
Magandang umaga mga kasangbahay. I'm Dr. Katrina Florcus Dacanay, your pediatrician for today. Sa panahon ngayon na nauuso na ang paggamit ng iba't ibang gadgets at cellphones, alam nyo ba na ang madalas na pagse-cellphone, paglalaro sa computer, yung paggamit ng video games ay isa sa nagiging dahilan kung bakit sumasakit ang mga kamay at ang pulso ng ating mga anak? Maraming important roles ang ating mga arms at wrists, lalo na sa ating mga maliliit na mga anak. At ukol dito ang ating pag-uusapan ngayong umaga. Ang sakit sa braso at wrist ng mga bata ay pwedeng magdulot ng mild o kaya matinding pananakit. Ito ay pwedeng may kasama na pananakit ng balikat, sa siko at sa mga daliri. Maraming pwedeng magdulot ng arm at wrist pain in children. Ang una ay ang strained muscles dahil sa labis na paggamit sa mga muscles. Ito ay usually nangyayari kapag ang mga braso at kamay ay ginagamit sa sports tulad ng swimming o kaya yung paghagis ng bola. Ang sakit ay pwedeng tumagal a few hours lamang o kaya hanggang 7 days. Ang second cause ng arm at wrist pain naman ay yung muscle cramps dulot ng labis na pagsusulat o kaya yung nagtatype ng madalas sa computer. Pwede din itong magdulot ng panandaliang sakit. Ang isa pang cause ng pain, ang infection naman mula sa viruses. Ang viral infection tulad ng trangkaso ay pwedeng mag-cause ng pananakit ng mga muscles sa braso. Isa sa seryosong cause ng arm at wrist pain in children ay ang septic arthritis. Ito ay isang bacterial infection sa mga joints. Ang symptoms ito yung lagnat, matinding sakit kapag ginagalaw ang mga kamay at braso. Pero paano nga ba natin malalaman kung matindi ang sakit ng braso, wrist at kamay ng mga bata? Mga kasambahay, mild lamang ang nararamdaman na kirot kung ang bata ay kayang gawin yung kanyang usual na activities na walang hadlang. Moderate naman ang pain kung ang pagsakit ay nakakagambala na sa kanyang normal activities at naaabala na yung kanyang pagtulog. Severe pain na kung hindi na komportable yung bata at epektado na ang kanyang pang-araw-araw na ginagawa. Mga kasambahay, ipakonsulta agad ang bata kung may mga sumusunod. Hindi nawawala ang sakit sa braso, wrist at kamay, hindi makakilos ng maayos ang bata, may namamaga na mga kulani, may pamamaga, hirap igalaw o may lagnat ang bata, gayon din kung may rashes na kasama ang pananakit. At syempre, gayon din kung may ibang unusual symptoms, ipakonsulta din sa doktor. Iwasan ang stress sa mga may karamdaman dahil ito ay pwedeng makaapekto sa kondisyon at pwedeng magdulot ng muscle tension. Ang pag-manage ng stress ay makakatulong na mawala ang sakit at pagkirot ng mga muscles. May mga minor na pagsakit at kirot na nawawala ng kusa, kung kaya payuhan ang bata na ipahinga at huwag po igalaw yung mga affected na braso o kamay. Pwede ring lagyan ng ice o kaya yung cold pack for about 10 to 20 minutes yung affected na bahagi ng katawan. Tandaan lamang na balutin ang yelo ng bimpo bago ito ipatong sa balat ng bata. Sundin po ninyo ang payo ng doktor kung may pain reliever na gamot na kailangang inumin. And of course, please consult your doctor if may nagtuloy-tuloy ang symptoms or kung lalo itong tumitindi. And that's it mga kasangbahay. I hope marami kayong natutunan sa araw na ito. As always, please consult your pediatrician for your baby's health. Thank you again for watching today's episode. Again, I'm Dr. Katrina Flor Cruz. You can reach me through my Facebook page, Dr. Katrina Flor Cruz, YouTube channel, Dr. Katrina Flor Cruz, and I also have my Instagram and TikTok, katrinamd.ph. See you everyone in our next episode.
And moving forward, pagdating po sa ating kalusugan, lagi po nating naiisip, mayroon bang prevention para di na umabot sa surgery ang ating mga karamdaman? Naku, ang tanong, is Carpal Tunnel Syndrome be prevented without surgery? Para po sa impormasyon, panoorin po natin ito.
Good morning mga kasangbahay. I'm Dr. Franklin Domingo, your specialist in physical medicine and rehabilitation for today. Ngayong umaga ay pinag-uusapan natin ang tungkol sa Carpal Tunnel Syndrome. At ang i-discuss ko naman sa inyo ay ang healing process once na nagkaroon tayo nito. Ano nga ba ang iba't ibang treatment once na nagkaroon tayo ng Carpal Tunnel Syndrome? Tara, isa-isahin na natin. Una ay ang non-surgical treatments at conservative methods na pwede nating gamitin para pagalingin ng natural ang ating mga pasyente. Ang pwede nating unang gawin ay tignan muna kung saan nakukuha ng pasyente ang kanyang Carpal Tunnel Syndrome. So, kung magagawa po yun, maiiwasan natin na lumala ang ating Carpal Tunnel Syndrome. Maiiwasan din po natin ang pag-alala po ng Carpal Tunnel Syndrome, lalo na kung na-diagnose na, kung magkakabit din po ng tinatawag natin na splint. So, sinusuot siya kalimitan paggabi para hindi gumalaw ang ating kamay at ang ating wrist. So, isinusuot po yun, carpal tunnel brace ang tawag po doon. Sinusuot po siya ng isang pasyente paggabi lamang. Bakit paggabi lamang? Kasi po, hindi na nagiging natural ang kilos po ng pasyente pag ginagawa niya ang pagsuot ng splint during the daytime. So napaka-importante po na sa gabi lang po isinusuot ito. Lalong-lalo na po para doon sa mga pasyente na nakakaramdam ng pangingimay o kaya pananakit dun sa kamay at nagigising sila. Dito po sa Makati Medical Center, pwede natin i-prescribe ang physical rehabilitation. Meron po tayong Center for Physical Rehabilitation, pwedeng gawin po yun. Pwede pong gawin ay lagyan ng mga modalities para painitin yung lugar na kung nasaan yung carpal tunnel area. Gumagamit din po tayo ng mga tinatawag nating paraffin wax bath. So, para mainitan po yung ating carpal tunnel at lumuwag siya. Pwede rin pong gamitan din po ito ng mga ibang modalities para lumuwag, katulad ng ultrasound, therapeutic ultrasound po siya, para lumuwag po yung pinagdadaanan ng median nerve gawa po nung init, na i-expand po yung carpal ligament na nasa ibabaw ng median nerve. Kaya pag lumuluwag po yun, mas makakahinga yung nerve, maaaring mabawasan yung nararamdaman ng pasyente. Lalo na kung i-combine sa mga exercises para sa carpal tunnel para mapalakas uli yung grip ng pasyente. So, yun po yung mga pwedeng gawin. Bukod po doon, meron din pong mga mobilization techniques, mga neural mobilization techniques para maipag-glide natin yung median nerve doon sa carpal tunnel. Mas maganda po yung maging glide, baka mas hindi na po maipit yung median nerve na naandun sa carpal tunnel. So, may mga therapy po na specific para doon. At yan ang naging talakayan natin ngayong umaga. Sana ay nakatulong sa inyo ang mga impormasyong aming binahagi. And for more natural tips, stay tuned dahil natural is beautiful. Only here at Naturally Yours.
Lagi natin tandaan mga kasambahay, early prevention is a key to avoid complications. Samantala, sa mga kababaihan, lalo na sa mga buntis, alam naman natin na maraming sumasakit sa kanilang mga katawan. Ngayon po, alamin naman natin, ano nga po ba ang dapat na gawin kapag sumasakit ang kanilang wrist at thumb pagkatapos po ng kanilang pagbubuntis? Para po sa detalye, panoorin po natin ito.
Hello, I'm Dr. Charo Filarca, isang adult rheumatologist, and welcome to Women's Health. Picking up and holding your new bundle of joy helps both of you bond and relax. Alam niyo ba na pwede itong makatrigger ng thumb and wrist joint pain, and this usually occurs after pregnancy? Ano nga ba ito? Ang wrist and thumb pain after pregnancy ay usually nararanasan dahil mayroon tayong tendon dito sa ating kamay na nagra-run dito sa ating thumb papunta dito sa ating hand. Itong tendon na ito o ang rope, mismong rope na nagdudugtong sa muscle at buto ay nagkakaroon ng maliliit na sugat. At pag nasugat ito, ang pinaka-covering niya or sheath ay namamaga at maaaring magkaroon ng lock mechanism dito sa kamay. Kaya kung naigagalaw ang daliri, ito ay maaaring mag-cause ng sakit. Ang sabi sa mga pag-aaral, may role ang hormonal changes dahil during pregnancy, nagkakaroon ng pagbabago sa ating hormones at nagkakaroon din ng swelling. Ito ang mga triggering factors kung bakit mas common ito after pregnancy. Hindi pa talaga alam ang dahilan kung ano talaga ang cause kung bakit mas madalas ang tendinitis sa mga babae. Pero ang sinasuggest ng mga studies ay ito ay dahil sa ating mas mataas na estrogen kumpara sa mga lalaki. Maaaring magkaroon ng pain, kirot o pamamaga dito sa wrist, thumb and wrist side papunta sa forearm ng kamay. At kung igagalaw mo ang thumb, maaaring magkaroon ng kirot din. At may limitation ng movement o limitado ang paggalaw ng thumb. Sometimes, yung ibang mga pasyente maaaring makaranas din ng parang may kuryente dito sa side na ito or ngalay. Para siyang merong sticky or catching sensation. parang may humahabol ba, parang naglalak dito ang daliri. So, yun ang mga simptomas na maaring meron kang wrist and thumb pain. So, sa thumb and wrist pain, usually, ang cause niya is yung repetitive movements or paulit-ulit na paggamit ng thumb at wrist. Maaari ding sa mga bagong panganak, ang maling pagbubuhat sa bata. Usually, pag naka-L position yung kamay. So, pag nabuhat ang bata na usually naka-outstretch yung kamay, so, isang factor din yun. So, dapat may technique din kung paano buhatin ang babies natin. Bukod po sa yellow and splinting, kung hindi naman breastfeeding ang pasyente, pwede tayong magbigay ng mga NSAIDs, either topical, yung pinapahid, or yung mga NSAIDs like mefenamic, naproxen, diclofenac, celecoxib, yung mga yan. Basta wala po kayong allergy. Well, nandyan naman na kasi talaga yung risk dahil ang pagbubuhat nga ng baby natin, isa na yung risk factor para magkaroon tayo ng wrist and thumb pain. Pero para mabawasan yun, pwede tayong gumamit ng mga support like yung mga pillows, special pillows for our baby para mabuhat natin sila ng mas maayos, or we can cradle our child using yung isang hand, scoop mo yung sa may likuran niya, mula sa puwet, papunta sa likuran, tapos susuportahan mo ng isa pang kamay. Pero dapat diretso yung wrist mo, hindi siya papaling na parang letter L. Makakatulong din naman ang paggamit ng splint para ma-ensure na naka-straight itong wrist joint. And kung nandyan na yung sakit, pwede naman nating lagyan ng yelo yung part na masakit, like for 20 minutes, then at least 3 times a day. And then, iwasan din nating buhatin ang mga babies natin na medyo malayo sila. So, ang ibig ko sabihin doon, kailangan lapitan mo muna yung iyong anak. So, malapit, and then doon mo siya bubuhatin. Hindi mo pwedeng i-stretch yung iyong kamay, and then you try to lift your baby. And isa pang bagay, syempre, kailangan din natin ng tulong ng iba pang kasama sa bahay. Like, nandyan naman si daddy. So, wag nating salohin mga mommies yung responsibility sa mga anak natin. Well, iba-iba kasi. So, the more na ginagamit mo kasi siya at hindi nakasplint yung area, so lalong mas tatagal yung pain. Pero kung itatry natin immobilize, like yung i-rest, tas immobilize, meaning hindi siya igagalaw with the use of splint, lalagyan ng cold compress, or yung pasyente umiinom ng mga pain relievers, pwede namang mas maaga. And kung kailanganin naman ng splint, kung sakasakali, usually 1 to 3 weeks ito. Kung ang pasyente naman ay mauoperahan, mas matagal, maaring tumagal ito ng 3 buwan. Malaking tulong ang exercise sa hands. So, may mga simpleng exercise. For example, you can stretch your hand like this, paharap, and then ipasok itong thumb paloob. And then after which, itry nating i-pull palabas. So, bilangan nyo lang ng 20 seconds yan. And then gawin 3 times, at least 3 times per day, para ma-stretch itong area na masakit. Kung minsan naman, pwede nating ilapag sa table yung ating hand, and then hatakin natin itong thumb na ito palabas. Magbilang lang din ng mga 15 seconds. So, pwede nating gawin 3 to 5 times in a day. Isa pang exercise is paganyan ng kamay, ipasok itong thumb, and then we try to push this thumb. So, magbilang lang din ng 15 seconds, and then mga 3 times per day. Actually, itong wrist and thumb pain ay common din sa atin na mga madalas mag-text. Sa cellphone naman, ang tamang paghawak daw kung may masakit na sa kamay is you hold your cellphone on your left hand, flat lang siya, and then gamitin mo yung isang kamay mo para makapag-text or makapag-browse instead ng ganito na letter L. So, ito yung i-avoid natin, yung maging letter L siya. It will cause thumb pain. So, ang wrist and thumb pain ay very common. Kung mangyari po ito sa atin, huwag po tayong mag-panic. So, number 1, ang massage ay makakatulong. Ang mga kasama natin sa bahay ay maaari din nating i-delegate yung mga trabaho, lalo na kung may bagong baby. Ang tamang pagbubuhat sa baby ay isang malaking factor din para mabawasan ng wrist and thumb pain. At saka syempre, kung hindi na kaya ang mga simptomas at matindi na ito, maaari kayong magpakonsulta sa doktor, lalong-lalo na kung more than 2 weeks na masakit ang inyong thumb. Kung meron pa po kayong katanungan at nais nyo pong magpakonsulta sa akin, maaari nyo po akong puntahan dito po sa Manila Med, 3rd floor, private OPD, tuwing Miyerkules, 9 to 11 a.m. or bisitahin ang Facebook ng Manila Med. Muli, ako po si Dr. Charo Filarca, isang adult rheumatologist. At lagi po nating tatandaan, lalong-lalo na po sa ating mga kababaihan, that our health matters. Magandang araw!
And with that, we conclude our today's enlightening episode. At ang lagi naming dasal sa lahat po ng mga may pinagdadaanan lalo na sa kanilang mga kalusugan, may God bring healing and guidance to each one of you mga kasangbahay. Always remember, early detection saves lives. Make your health a priority. But before we end, take a moment to watch this.
Watch these snippets for the upcoming episode on Sunday.
Well, tonsillitis is an infection. So there's an infection in your tonsils, causing problems like fever and sore throat.
At yan po mga kasambahay ang aabangan natin sa susunod na linggo. And as we wrap up today's episode, we'd like to extend our gratitude to all our viewers for their unwavering support. And I would like to greet ang ating Kuya Daniel Razon na wala pong sawang sumusuporta sa mga adhikaing serbisyo publiko. At syempre ang ating BMPI's General Manager, Mr. J. Eusebio. May God always protect you both and grant you a healthy life. And syempre, before mag-end, gusto ko din batiin ang aking kambal, si Iyo and si Iya. And hi also kay EJ and kay Dr. Alamin at sa mga pasyente po natin sa Barbacabodil Health and Wellness Center. Pinabati din natin yung mga taga-Delicates Food Corporation. And syempre, nanay and tatay, I love and miss you both. At sa ating mga kasambahay, maraming salamat po sa patuloy ninyong pagtangkilik sa Doctors on TV. And please like and follow my Facebook page. Just type on Facebook search box, Dr. Sara Barbacabodil. We hope you found this discussion informative, empowering, and inspiring. Remember to follow us on social media for updates. Don't forget to tune in next time, God willing. Muli po, magandang umaga at maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barbacabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsal Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor, Ayala North Exchange Tower 1, Legazpi Village, Makati City. We would like to thank Adlaon Optical, located at ground floor Super 8 Warehouse Poblacion, Baliwag, Bulacan, 0922-878-5911, and second floor Aliw Complex, MacArthur Highway, Calvario, Meycauayan City, Bulacan, 0922-861-2095. Asian Breast Center is a premier healthcare facility dedicated to breast health and wellness. It specializes in breast cancer diagnostics, treatments, and disease management, offering state-of-the-art technologies in treatment guided by American standards and guidelines. Visit their Facebook page at facebook.com/Asian Breast Center PH. The Asian Breast Center is located at the 8th floor of Centuria Medical Makati, located in Kalayaan Avenue, corner Salamanca Street, Barangay Poblacion, Makati City. The center is open Monday to Friday from 9 a.m. to 4 p.m., except holidays. To get the best level of care, you can book an appointment by calling their mobile number at 0917-127-3278 or send inquiries through email ask.abc@asianbreastcenter.com. Breast cancer is curable and treatments are affordable when detected and diagnosed early. Lindison Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgsalesco@gmail.com. Clinica Figura, located at Entrata Building, Philinvest, Alabang. You may contact them at 0917-317-7272. Barbacabodil Health and Wellness Center, located at Unit 1531, Centuria Medical Makati, Century City, Makati. You may contact them at 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Dr. Sara Barbacabodil would like to express her gratitude to Medical Depot, healthy num-num food. Where we do.